welcome, 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 everyone. It's been quite a while. My name is Sharonica Burgess. I'm the CEO of the Barclay Group Incorporated, and I want to extend a very warm welcome to our Fireside chat today. We have a really good treat for y'all. We are going on episode 9, okay? And so you guys have asked, we wanted to deliver. You had a lot of interest in women's health, so we have a very special guest who is going to be participating in our health education and advocacy playground that we build here on the Fireside Chat. Her name is Dr. Stephanie Hack. She is a physician entrepreneur, a healthcare thought leader, the Lady Parts doctor, podcaster, and blogger, amongst many, many titles. Her medical specialty is obstetrics and gynecology, and she is here, guys, to really share with us, well, us, mostly ladies. Let's just say this is a ladies' Fireside Chat today. 5 things we should know about our menstrual cycle. So we're talking periods today, guys. We're really getting in there. So I hope that you're ready to dive in. And Stephanie, take it away, Dr. Hack.
Excellent. Well, thank you very much first for inviting me to have this conversation.
Indeed.
I love talking about women. Well, first, I love women's health.
Yes.
And I love talking.
Mutually exclusive and together.
So and together, it's like, so thank you for that. And yes, we are not just for the ladies, okay? We are for anybody who identifies as having a uterus, a vagina, a cervix. You know, we're all inclusive, and anyone who doesn't, but just wants to know a little bit more about it.
I love it. And fun fact, though, I want to drop in there, Dr. Hack went to undergrad at UVA, so she is a fellow Wahoo, okay? So let me just shout out our Wahoo very quickly. We got to set it down, let folks know, just before we get started.
Wahoo, I'm like ashamed to say how long ago it's been since I graduated.
We will not. That is not the topic of today. I just wanted to put that out there for folks, for public consumption.
Yes. So we are talking about the menstrual cycle.
Yes.
And it is something that I think, we all feel like we really know about it. We're all experts in it to some degree, right? Because you have one.
Right.
But usually what we go from is our own experience. And when you're going from your own experience, you're always kind of wondering, like, is this supposed to happen? Is this, like, I don't like to use the term normal, right? But really, is it normal? And so we're just going to talk a little bit about it and give you just some background information as far as things to expect, things to not expect. So one of the first things that I think is great is just to talk about the menstrual cycle in itself and what exactly that means. Okay. So the menstrual cycle starts on the day your period starts, or the day menses starts. And then the cycle ends the day your next period starts. Right. So definitions are important. A lot of times we think the menstrual cycle, it just happens to be my period or when I'm actually menstruating, but it's not. So when you hear us talk about, every 28 days or something like that, that's saying your cycle length is 28 days.
Got it.
An average. In that you will bleed, and you can bleed. Usually the average is anywhere from 5 to 7 days. Okay. Your periods really shouldn't be much longer than 7 days. Like 8, 9 days. Okay. I thought you were going to ask something.
I was, but I'll wait.
Okay. All right. I hope you write it down, because I forget things as soon as I think them. So when you're thinking about the menstrual cycle, the average length for a menstrual cycle is anywhere, I've seen 21 to 35 days, or something like 24 to 39 days. And if you're charting your cycle and you're getting it roughly that often, then that's a good sign that you're ovulating and that things are going as expected.
Good. Okay. Are there any things that will impact the length of a period or your cycle?
Oh, there are lots of things.
Or am I jumping too far ahead?
Let's come back to that.
Okay,
there are
let's circle back.
Yeah, but it's good to think of it as a vital sign, right? Like our heart rate is a vital sign, our blood pressure is a vital sign. Well, your menstrual cycle is also a vital sign. things that need to be checked out, investigated, can lead you to have an abnormal menstrual cycle.
I like that.
Yeah.
The analogy to a vital sign, like it is
Mhm.
for
It
it really
is.
is. I've
It
never heard it
is.
described that way though.
Oh, sure. Yeah. There are plenty of times where someone comes in, and the way that we figure out that something else is going on is by focusing on their menstrual cycle.
Mm,
So that happens a lot, probably
okay.
more than people realize.
Mm,
And another thing to mention about your period. So your hormone levels are going to fluctuate throughout the cycle. And so one thing that people ask is like, oh, my mood changes when I'm on my period, or like just before my period. Is that
PMS setting
normal?
in.
Yes, and
Like,
that's
Aunt Tracy is
PMS.
coming because I feel XYZ. Yeah.
Yes. So for PMS, you can have symptoms of like depression, anxiety, irritability. You can experience also like certain other symptoms as well. So your hormone levels, some people are just more sensitive to them. That's just life, right? Like
Right.
I'm particularly sensitive to freshly cut grass. Some people are more sensitive to hormone levels. And so as your menstrual cycle progresses, there are hormone levels that are changing. Your ovaries are making hormones, and estrogen is going to happen and increase in the first part of your menstrual cycle leading up to ovulation. Around the time of ovulation, you're going to get an increase in progesterone, and then those levels they'll taper off, but they'll still be there.
Okay.
And then just before your period comes, those hormone levels are going to decrease.
Okay. They kind of go off a cliff, or are they like steadily
It's
declining?
it's steadily, quickly.
Okay. Sort of kind of slow fast.
So some people really feel it.
Okay.
And so you might start to experience those symptoms. If you experience severity in those symptoms, it's a little, for some people it's a little bit more. It's PMDD, premenstrual dysmorphic disorder. I know I'm like messing it up, of course, because now
No.
we're talking about it, but PMDD, you
Yeah.
can experience a more severe
Okay.
expression of those symptoms of the depression, anxiety, irritability, anger, things of that nature. So all of this is to say, yes, your menstrual cycle can affect your mental health, and that's
Got
part
it.
of the hormone fluctuations.
This is so key. First, the vital sign. Now, your mental health, because we go about our days, we get it done. But we really need to tap in and say, hey, I hate to say this term, but as a consumer of healthcare, is this normal? Or am
Right.
I going off the edge? You know what I mean? And be
Right.
able to know, okay, when is it time for me to tap in with my doctor, or to,
Mhm.
to put the flag up and say, hey, I may need some help.
Sure. And sometimes it won't be you that knows.
It might just be others that notice before you. That's very true, Dr. Hack.
They might know.
They may have tapped in a few days prior to you even knowing. Yeah, that's true.
Exactly, because usually those symptoms are going to start to happen about 4 to 5 days before your period actually comes.
That's good. I
So
love
you
it.
might know, but it
But
might be the
they
people
have
around you.
known.
They
That's
are tuned in.
that's good. That's good. All right.
But there are other things that you can, someone who has depression and anxiety already, those things can be made worse.
Okay. They
Or
escalate.
it might not be that you actually have PMS. You could have baseline depression and anxiety.
That's true.
So it's good to be in dialogue with your healthcare provider about this to figure out, like, is this cyclical? Is this related to anything? Or is this something that really just happens right before my period comes in around this time? Excuse me, 1 second. I told you I have that freshly cut grass
No, that's okay.
allergy.
It is the season. Pollen, allergies. We're in Georgia, and the pollen is like, okay, who done it?
Right. I'm in my house, but still somehow affected.
Yeah.
So sometimes it's a matter of doing medications to like birth control, for example, hormonal based birth control, to keep
Okay.
the hormones level so you don't experience that fluctuation. Mhm.
Okay.
But sometimes you really need to also see a mental health care provider.
That's true. So
Mhm.
it really boils down to a lot of self-awareness, like just being very in tune with your body, taking note and being able to identify by being educated.
It does. Yeah. Self-awareness, and then continuing an open dialogue, about your symptoms and what you're experiencing.
Right.
Yeah,
Good.
which
All
requires
right.
self-awareness.
Okay. We're getting there. Okay. I like it. I like it.
So other things that you should know that are important, and I don't think that we do a great job of explaining this in healthcare, but your menstrual cycle and specifically your periods,
Mhm.
but both really are going to change throughout your life.
Yes, can I echo this?
Mhm.
Because I'm like, okay, when I started my menses, it was kind of this thing going on. It was this many days. It was this much heavier flow. Now it switched up a little bit. And the question came back in, is this right? Is it supposed to
Mhm.
be changing? And now as we go into our seasons, part of life,
Not there yet. But on our way.
we're on
On
a,
our way.
we're
Taking our
cruising,
time.
slow cruising, slow cruising to that part, but more thinking about the changes. So I do want to learn more, and I'm pretty sure our viewers want to learn more about those too.
Sure. So one of the first things is most women and people with uteruses, they're going to get their period around the age of 12,
Mhm,
13,
mhm.
like 12.75 years, I think is the number, but around 12,
Okay.
13. And that can be different in African Americans and Latinos. I think they tend to get theirs about 5 months before that average. I know personally, I got mine when I was younger than
Yeah,
12.
I was on a late,
Um,
but
Say that again.
I was on a later side. Yeah, you.
Okay. Yeah. So it's just an average. And when your period first starts, for all of us, there's a communication between some organs in our brain, and then they speak to our ovaries. And
Mm,
then the ovaries start creating the hormones that will ultimately lead you to have a period. And so there's something called the hypothalamic pituitary ovarian axis,
okay.
HPO.
Yep. Now.
But we're going to make it more
Okay.
simple.
Yeah.
So the hypothalamus communicates
Okay.
to your pituitary gland, and they're all here. And then they create hormones that tell your ovaries to basically make hormones.
Got it.
And the pattern in which the ovaries make the hormones and those hormones are communicated, basically say when your period starts, your
Okay.
ovaries make the hormones. Well, that process is still developing when you get your period at 12 or 13. So that's why for many young women, young people with periods, their period won't necessarily be regular to begin with,
Got it.
because this communication system is still maturing. And
Mhm.
so it might take a little bit of time. Sometimes people get a period and then they could not get another period for a few months later.
Good to
And
know.
yeah, and that's very common. But within 3 years of that, you should, or 2 to 3 years, you should definitely be having a regular cycle. And so that's another key factor as far as thinking of the period and the menstrual cycle as a vital sign, because if that's not happening,
Mhm.
then there could be something else that needs to be
Got it.
investigated.
That's good. We did have one question about period irregularity, so it's good to
Yeah.
address it when you start. That's normal, and then we can hop back around.
Yeah, sure. So you should ultimately then start to have your period regularly, and that cycle length will change throughout your life. Even when you're not in the season of perimenopause,
Yeah.
you may start to notice that your period is getting shorter, or your cycle length is getting shorter. Maybe your cycle length is getting longer. And then once you reach perimenopause,
Okay.
the average age of, so menopause is when you have not had a period for an entire year.
Okay.
And then you say, I've gone through menopause.
Wow.
The
Okay.
period of time, or the length of time, I want to make sure I use period only to talk about when you're bleeding. The length of time before that, when your cycle and the bleeding starts to shorten, or that cycle lengthens,
Mhm.
that's when we call that perimenopause. And during that period of time, your ovaries are actually starting to close up shop. They're like, just sending you a little message here.
Clearance
It's not
sale.
closing. Don't get any ideas.
Come get your last items.
Make some
This
decisions.
is last call. Just letting
That's
you know.
right, last call. And so they start decreasing the amount of estrogen. They're just not making as much estrogen
Okay.
as they used to when you were in your more reproductive years.
Got it.
Now, that is not to say that you cannot get pregnant.
Okay. Throw
Okay.
that little tab in there. Say that again, Dr. Hack.
It is not to say that you cannot get pregnant. So if you don't want to be pregnant, you should be using a good contraceptive option, whether that be medication or an actual method or device.
Yes, I just want our viewers to hear that.
Yeah, because I have, and even though this is incredibly uncommon, but I have gone and seen patients in the hospital. I remember this woman, she was 49 and she thought she had gone through menopause and she was pregnant because
Oh my God.
your ovaries are closing shop, but it's still working.
Yes, they got in right before the door closed.
Right. So that is how your menstrual cycle will change. And at some point when you go through perimenopause, when your periods start to space out, the menstrual cycle starts to lengthen. If you're having a lot of bleeding or issues there, that's still an important conversation that you need to have with your healthcare provider, because there can still be other things that are going on that we need to check out, specifically things like cancer of the lining of the uterus. It's called endometrial cancer.
Yeah.
So I'm giving you information, but I don't want you to be like, oh, she said like this was normal. No.
No.
Still have a dialogue with
Right.
your doctor, because even within that, there's still some things that require investigation.
What we're saying, be self-aware, but keep the communication going because each of our bodies are different.
Exactly. And we don't want to miss something
Exactly.
important. that's not normal. Other things. So everyone's amount of bleeding is different.
This is
Okay.
another big one too.
Yes, everyone's amount of bleeding is different, but we still have an amount that seems the amount that we consider, if you have higher than that, you're having heavy periods and you need to talk to your doctor or a healthcare provider about that. So if you are bleeding more than 80 milliliters a cycle, and what does this mean, right?
I was
Like,
just
who
going to
knows?
say, for the prudent lay person, just, living life, being joyful, what does that equate to?
Sure. So it's hard to say, and nobody's actually measuring out the amount of bleeding that they have. But if you wear, for example, tampons, like I did this experiment on myself, like how much bleeding am I actually having? When you saturate a tampon, meaning you've inserted it and it's full when you take it out, you look at it, it's completely soaked.
Right.
You can look at the box that your tampons came in, and it will tell you the amount of bleeding that tampon should take.
I was today there years old knowing that. I've never actually read the side of a tampon box. To be honest, I
Yeah.
even know. I just kind of monitor
Yeah,
by observation, right?
sure. And I'm thinking about it. I'm not sure if it's on the box. It might be on the box, or at least it's on the insert,
Yeah.
but somewhere you will see the amount of milliliters. And this is like a very specific way to do it. But you can assess like how many of these am I needing? Am I saturating? How often am I changing them? And you can kind of figure out a tally of approximately how much blood you're losing
That's
with your
good.
cycle,
Right.
I think. But otherwise, when I'm having this conversation with patients in my office, I usually ask, okay, how often do you change pads or tampons on your heaviest day?
Right.
And if they're telling me, oh, like every 4 hours, every 6 hours, or maybe I only do it 3 times a day, then I'm like, okay, you don't have heavy periods, right? Because there are some women who go through a whole box of pads, like saturating them, on their periods. There are other people who might only need like a pad a day or a couple of tampons a day. So that's a good assessment. Now, if you're wearing, and I always ask, like, what size are they? So if you tell me I use regular tampons, I go through like 3 regular tampons in a day on my heaviest period. That is not a heavy period.
Right. Versus, using an overnight tampon, the size that is a good point too.
Right, exactly. I was having a conversation with someone about this yesterday, but they have, and I'll use Tampax Pearl, for example, because that's just easy for me to remember, but they have light, they have regular, they have super, they have super plus, and then they have ultra.
Right. As if
And they have ultra.
Yeah.
And I will tell you, you can't find an ultra tampon in just anybody's community.
No. Yes.
But you go into our community and you will find some ultra tampons
Isn't that interesting though?
because they know.
Yeah.
So this is getting to the further discussion about something like fibroids. So
Yes.
fibroids are benign tumors, usually benign tumors of the uterus.
Mm-hmm.
And for some people with fibroids, they will have heavier bleeding.
Mm-hmm.
So if you have heavy bleeding, and especially if you have a family history of people with fibroids, which most people do because most women and people with uteruses ultimately develop fibroids, like
Right.
70, 80% black,
A high
white,
prevalence. Yeah.
it's a lot. And they're not necessarily big,
Mm-hmm.
but some people do get bigger fibroids. And depending on the location of the fibroids in your uterus, they can
Mm-hmm.
cause you to have some really heavy cycles. Hence, you come into our community
Drill it
and they got
home.
ultra tampons.
Yes. Right. Because, well, one selling point, two, they're needed because of our
They're
prevalence.
needed.
But this drove home, and I wanted to echo your point that being self-aware, because even in my own circle of family and friends, there's been a lot of us who have uh, been diagnosed or have been treated for fibroids, most of them
Mhm.
having to have them removed. I have
Okay.
often had 14 of them, sizable.
Mhm.
So we want to echo this, like when you're taking this time to be more self-aware how your body is acting, trending it in that dialogue. So don't be afraid to say, hey, Dr. Hack, I noticed that I'm going through 2 or 3 more tampons than normal.
Mhm.
What do you say to this? And I say this because it's supposed to be a relationship, a rapport with your doctor so that you feel
Right.
comfortable even saying, I'm busting the doctor, hey, look, I tell her like, this is going on. She's like, now, Miss Burgess, I'm really down. But I really want to drive home the comfortability of having that conversation. So where when there is a time, or if there is a time, such as when you may suspect you have a difference in your menstrual cycle or the bleeding, you can go comfortably and say, hey, not quite sure, I don't know, but can you help me with this? So,
Yes. Yes, and yes. And you know, your relationship with your healthcare provider should be such that you can mention these things and that they will hear you
yes,
and
indeed.
respond appropriately to your concern, not with a just kind of
Yeah.
moving on to the next
Yeah.
thing. So, with that said, if you have a concern for fibroids, you should be sent for an ultrasound.
Got it. Got
I
it.
mean, it's simple.
Simple.
And I want to say this on this chat because I have had, excuse me, my nose is like running like
It's
crazy.
okay. Like I said, we're at the playground. When you're running around, damn your forehead, nose, whatever you need to do.
But I have spoken to a number of patients recently, Black, white, who
Yeah.
will say, I think of one, a dear friend who said, she was, I think around this time, maybe she was 38. She was
Mhm.
having heavier bleeding
Mhm.
and the doctor didn't recommend an ultrasound. And I'm like, why? I don't understand. Is there some reason? Like, is your insurance not allowing ultrasounds? Because we give
That part.
ultrasounds
Yes.
for, we don't require a lot. Like, I'm like, okay, African American woman
Right.
in her late 30s with heavy bleeding says fibroids to me.
Right. It's
Let
like
me
a
send her.
predisposition. Like that could be a clinical guideline. Predisposition to have an
Right.
ultrasound. Mhm.
Exactly. And then another woman I met recently who was not African American, she's Caucasian, and she said she was concerned that she had fibroids and then
Mhm.
the doctor wouldn't send her.
Mhm.
And do you know, this is a Caucasian woman with a Caucasian provider. And I was like, this is so interesting to me,
To see.
you know, that we are acting as gatekeepers when we should
Mhm.
really be acting as advocates. It's about something like an ultrasound. It is not a um experimental
Right.
treatment or
And
do you
I-
know
and to add to that, and I'm always a big proponent of just health consumption and just edification of the patient.
Mhm,
Even if insurance doesn't cover it, I always like, doc, you can still, as a doctor, still offer it as
mhm.
a preventative measure. And healthcare goes up and
Yeah,
down in terms of coverage and things like that, but that shouldn't be an
right.
impediment to you getting your healthcare. And I echo that. So,
Yeah,
I'll still ask your practitioner when we really do hope that our providers are offering that so that we can be on the preventative side versus
right,
on the post-operative or the post, the back
right.
end of a care plan in terms of getting help. So I wanted to make that a regular item and so that our viewers can chew and consume on because this is normal. Sorry to
Right.
use that term.
Right. No, it is. So, I just wanted to take a moment to really hone in on that. Like, you should be getting an ultrasound if you have a concern about fibroids to see. And this is a transvaginal ultrasound that they do usually, where we have a probe that goes in the vagina, but it really allows for the best view of the uterus, of the layers, the muscular, the endometrial lining, which is the lining inside the uterus, and also for looking at your ovaries, your fallopian tubes. So it gives us a really great view of your pelvic structures and trying to see where the fibroids are. And then for certain people, they need additional imaging, which will be done through an MRI to
Okay.
really look, depending on what your treatment options are and what you might select. But yeah, that's very important.
Quick question before I forget. For those who are active, would the flow or the heaviness of period blood change, or would it be increased if you're an athletic person, say you're a runner or you weight train? Does that impact your flow at all?
Sure. I was like, active. Does she mean like sexually active?
That's yeah. Let me be specific.
But specifically athletically active.
Yes.
It can. So for people who work out more, you may have a lighter flow, and that's part of the hormone communication in your body. So that's why you may see, for example, like Olympic trained athletes might not get their periods
Hmm.
if they're
Right.
training a lot, or they might not get them regularly.
Right. That's been known
So
for
it's
gymnasts and things. They say that.
right.
Yeah.
Exactly. Exactly.
And the other question, I have to write them down, like you said, Dr. Write them a little list. Back on preventative care, if you suspect that you have a fibroid or were told by your practitioner, what are things we can do to prevent or during that period? So if you know that you have a fibroid, what can you do? If you're trying to be on the preventative side, what can we do?
Sure. So there's not really at this point something that we have that prevents fibroids for you. We sometimes put patients on like hormonal birth control, like birth control pills to help with the symptoms related to fibroids, or like an IUD, a hormonal IUD, like Mirena, for example,
Mhm.
to help. And, I don't think there's great evidence really on prevention.
Right.
Although that will help some people because again, we're all different and we all respond differently.
Exactly.
But it's more kind of dealing with the symptoms and figuring out, are these, for many fibroids, we don't have to do anything about them because they're not bothering you.
Hmm.
But if you're having periods that are heavy, if you're having symptoms of just, we call them bulk symptoms, where you're having to go to the bathroom frequently because your uterus is so big that your
Right.
fibroids are pushing on your uterus, or I'm sorry, your uterus is so big that your fibroids are pushing on your bladder.
Got it. Yes, I knew what you were saying.
Yeah. And so those are things that we need to, things that we need to treat. But, for prevention, it's more kind of managing
Mhm.
symptoms. And then if you're developing fibroids that need to be treated, then having that conversation about treatment with you.
That's good. And it brings about one of the stories they had one of my close girlfriends too, that she had a couple and she was with child. And they told her
Mhm.
that they may get larger while she's with child, but they may shrink afterwards.
That's very common.
Okay.
Very common.
Okay. I didn't mean to take us on a segue. Let's get back. Our things
That's okay.
now.
I only had one more thing to talk about.
Okay. Good, good.
So with your menstrual cycle and specifically cramps, and you're on your period. So cramping on your period is common. And that part of that is there's a release of these inflammatory markers and chemicals in your body that
Okay.
causes you to experience pain and cramping. But if that pain does not go away with like Motrin, ibuprofen, naproxen, Aleve, Pamprin, something like that. If you find that it's not being relieved with those kinds of painkillers, Tylenol, then that could be a sign of endometriosis. And
Got it.
we talk about endometriosis, but basically what that is in your uterus, there is a lining on the inside that's sloughed off every month as your period, or at least once in your menstrual cycle, right? That's your actual menstrual blood, is this lining of the uterus. You didn't get pregnant, you didn't have a baby, and we need to get a new home together.
Okay. I like that.
For, yeah, it's time to get a new home. We're
Yeah.
doing that every
Nice
month.
little look in here.
So sometimes that tissue can grow in other parts of your pelvis, not just in your uterus. It can grow into the muscular walls of your uterus. That's called adenomyosis.
Okay.
It can be on your ovaries and cause cysts. Those are called endometriomas. Often it's in like certain spaces in your pelvis, but that's all types of endometriosis.
Okay.
And when you have your period or during your menstrual cycle, just like the lining in your uterus is responding to those hormones that are coming, that communication to your ovaries, and then the ovaries are making the hormones, that tissue is responding as well.
Okay.
And so that can make you have a lot more pain because there's a lot of inflammation. This tissue is not where it's supposed to be. And so you can have very painful periods. For people with endometriosis, they can have pain with sex. They can have painful bowel movements, depending on the extent of the growth of that tissue into their pelvis. They can have bleeding with bowel movements. So there are a lot of symptoms. Now, mind you, not everybody who has endometriosis has symptoms.
True. Okay. Yeah.
Okay. And your degree of symptoms does not necessarily correlate 100% with your amount of endometriosis. So some people can have a lot of endometriosis and no symptoms. Some people can have a little bit of endometriosis and a lot of symptoms.
Wow. Okay. No, that's
we're individuals.
right. Exactly. And one thing that comes to mind, so with that being said, how is it usually diagnosed? Is it through pap smears or
Sure. That's I love that you asked that, because I get to say pap smears are only for cervical cancer screening.
Another
Also, you can have anal pap smears for, anal screening for the same disease of the anus. But generally, most people, you're just having pap smears for cervical cancer screening. Endometriosis, often what we'll do, because at this time, there's only one definitive way, and that is to open you up, look in your belly and or in your pelvis and find the tissue, send it to the lab, and have the pathologist confirm that it is endometriosis, endometrial lining.
Wow.
That is generally done through something called diagnostic laparoscopy. So where I'm going to start pointing at body parts you can't see because we're on the camera, but we basically put a camera through your belly button, look around your pelvis, and then we look to see if we see tissue that's concerning for endometriosis. So that's how we diagnose it. But because we're not necessarily recommending surgery for everybody, we usually start first by starting some kind of hormonal medication, whether that be birth control, to see if we quiet those hormones, if we prevent ovulation and prevent the periods, does it get better? And if you're having a really good response to that, then you might have endometriosis. But definitively, if we really want to diagnose and say, we would do a diagnostic laparoscopy. We have imaging that we do. So ultrasound, sometimes if it's severe, you can see it on ultrasound, or if you had like an endometrioma, which is endometriosis of the ovary, a cyst, you could see that on an ultrasound. So we usually recommend that if someone's having painful periods, we'll send you for an ultrasound to see.
That's good.
Yeah, but often that will come back showing nothing. And so definitively, we'd have to put the camera in your belly.
And speaking of the camera, is this a arthroscopic camera, a small camera? Because I know folks like, oh, a camera, you can go all in. I want them to have a really factual and foundation of what the size camera experience, so they aren't fear factor out of getting the treatment they need.
So it's an endoscopic camera for laparoscopy, and like I'm showing my pinky, it's about the size of my pinky.
Got it.
We make a small incision, usually about 5 millimeters at your belly button. It's small. And then we put the camera through. And that's how we're able to get into the pelvis. So we fill your belly with gas, and then it kind of moves everything out of the way. And then we have a direct view into your pelvis to look around and see what's going on.
good. I just didn't want to leave it up to the imagination.
Sure. They're like, you got the iPhone in there?
Like the whole, let me see. Yeah, so that's good to know. That's good. This is good. Well, listen. Anything else that you like to share? I know we did the we covered a lot of ground actually.
We have, these are, I know I'm not being super specific, but I think these are just kind of some good starting points. Starting points for everyone to go and do their own research or ask their own questions. And I really just wanted to provide some information just so that we have it. So as these things happen, we're kind of like, oh, okay, like this is something that I should anticipate. This is something I know, like, which is why I really wanted to say your menstrual cycle is going to change. Because I think these are things that we just don't tell people regularly.
And it's so important, Dr. Hack, because this is the foundation that we have of becoming more self-aware. So we need to start here and then dive deeper as we go to our providers, as we live our lives, we do all the amazing things we want to do, that we're still cognizant and know we have this playground where we can come and talk to providers like you who are awesome and amazing and break this down and raise the roof. Break this
my
down.
Shoulders shimmy shake.
I love it. I love it. So that we understand, in day-to-day life. So it's amazing. And I have one last question because I'm asking for a friend.
Okay.
You've been asking for a friend. Now, exclusive breastfeeding and periods.
Mm-hmm.
You still become pregnant while you're breastfeeding.
Oh, you most definitely can.
Yeah, I just wanted to put that out there on the playground for public consumption.
Yeah, you most definitely can. And usually we say you're only really going to get protection for like the first 3 months for sure.
Yeah.
And you have to be exclusive.
And let's harp on that for a minute, because this is a misconception that I often hear in dialogue, is that, okay, I'm exclusive breastfeeding. That does not include breast pumping, correct?
No, it does.
It does. Okay.
It does include pumping because you're still stimulating the nipples and the breast,
okay.
But it does not include giving your baby formula.
Got it. All righty.
Mm-hmm.
You heard it here.
Mm-hmm. That's right. So if you don't want to be pregnant after that, first 3 months or first 12 weeks, you should start using some kind of backup protection if you are sexually active. And that's a conversation you can have with your provider. There are lots of great options for things that you can use while nursing. Some people don't want to use anything, so they use the rhythm method. But like when you're nursing, if you're not getting a period, you don't really know when you're ovulating. So or it's harder to know accurately. Let me say that. But yeah, so exclusive breastfeeding, you have to be careful if you're not okay having another baby so quickly.
Taking notes for a friend. Friend equals hubby.
They're great questions.
No, just put it out there. No, this is awesome. Thank you so much, Dr. Hack, for just
You're welcome.
Your time, your talent, your treasures. I'm appreciative. I know our viewers are. This is an amazing fireside chat. They have been wanting this for a long time, like over a year. So I said, you wait, I'll get someone for you.
I'm happy to do it.
Yes. If we have any questions, guys, let us know. Also, don't forget to check out the Lady Park Docs podcast and blogging site. We want to drop it right here in the description. So go check her out. She has an amazing amount of various topics that she covers. They're awesome. Tune in, drop her some questions, show her some love, like and subscribe. That's what we do here in the village. So until next time, we love you all and we'll see you later.